Did you know that a heart attack can strike without the dramatic chest pain you see in movies? For older women, this silent killer often hides behind symptoms so subtle they're mistaken for something else. Today, we're diving into why recognizing these silent heart attack symptoms is crucial. It's not just about understanding the signs, it's about taking control of your health and potentially saving a life. Let's take a moment to imagine Clara, a vibrant 72-year-old grandmother. She loves her morning walks and has always been active, tending to her garden and chasing her grandkids. But lately, she's been feeling exhausted, as if her energy has been drained. Does this sound familiar? Many of us can relate to Clara's story, which is why understanding the signs of a silent heart attack is so important. She brushes it off as just a natural part of the aging process. It could be the stress of keeping up with family, or it's that pesky indigestion from last night's dinner. However, what Clara doesn't know is that this fatigue could be a silent symptom of a heart attack. Silent heart attacks in women are sneaky. They don't always come with crushing chest pain or prominent warnings. For women over 70, heart disease is a leading cause of death. Yet, many miss the early signs of a heart attack in older women. Why? Because the symptoms are often vague, they can be easily confused with other ailments. Let's talk about what a silent heart attack is. It's a heart attack that happens with minimal or no symptoms. The damage to the heart still occurs, but the warning signs are so mild they're often ignored. And for women over 70, this is a more common occurrence than you might think. Older women are especially at risk. Their bodies may not react in the same way as those of younger people. Hormonal changes after menopause increase the risk of heart disease symptoms in older women. Clara's story isn't unique. Many women chalk up their symptoms to aging or stress. They might feel short of breath, have mild nausea, or notice a strange discomfort in their back or jaw. These aren't the classic signs of a heart attack that we're taught to recognize. That's why female heart attack warning signs after 70 are so often overlooked. And that's what makes them so dangerous. Let's break it down. One of the most ignored symptoms is unusual fatigue. Not just feeling tired after a long day, but a profound, overwhelming exhaustion that doesn't make sense. Picture Clara again. She's been slowing down on her walks. She feels like she's carrying a heavy weight, despite being fit for her age. She thinks, "I'm just getting older." However, this kind of fatigue can be a warning sign. It's one of the early signs of a heart attack in older women that's too often dismissed. Another subtle symptom is shortness of breath. It might feel like you can't catch your breath after climbing stairs, or it could happen while you're sitting still. This isn't just being out of shape. For older women, it could signal a heart struggling to pump enough blood. Paired with fatigue, it's a warning sign you can't ignore. Nausea or indigestion is another sneaky symptom. Many women think it's just something they ate. But if it comes with dizziness or sweating, it could point to a silent heart attack in women. Jaw pain, back pain, or even arm discomfort can also be clues. These symptoms don't scream heart attack like chest pain does. That's why so many women miss heart attack signs. Let's talk numbers for a moment. Heart disease kills more women than all cancers combined. Women over 70 are at higher risk due to aging arteries and changing hormones. Silent heart attacks are hazardous because they can go undiagnosed. Studies show up to 40% of heart attacks in women are silent. That's a terrifying statistic. Without treatment, these silent attacks can weaken the heart over time. But here's the good news: they can be prevented. By increasing awareness and making lifestyle changes, we can lower the risk of a more severe heart attack in the future. This is why awareness is not just important, it's critical, and it's a reason to be hopeful and motivated. Let's go back to Clara. One day, she feels a strange pressure in her chest. It's not sharp pain, just an odd heaviness. She ignores it, thinking it's just stress, or maybe her acid reflux acting up. But then she feels dizzy and clammy. Her daughter notices she looks pale and urges her to see a doctor. Reluctantly, Clara agrees. At the hospital, tests reveal she's had a silent heart attack. The doctors are clear, Her fatigue and mild symptoms were warning signs. If she'd ignored them longer, the outcome could have been worse. This underscores the importance of early detection in preventing severe heart attacks. This story resonates deeply with many families. Older women often put others first. They downplay their symptoms, not wanting to cause a fuss. However, the truth is that ignoring these signs can be deadly. Heart disease symptoms in older women need to be taken seriously. Early detection can make all the difference. So, what causes these silent heart attacks? Aging plays a significant role. As we age, blood vessels can become less flexible, making it more difficult for blood to flow. High blood pressure is another culprit. It puts extra strain on the heart. Many older women don't realize their blood pressure is creeping up. Cholesterol buildup in arteries is also a significant factor. Over time, plaque narrows the arteries, reducing blood flow to the heart. This can trigger a silent heart attack. Diabetes is another risk factor. It damages blood vessels and increases the risk of heart disease. Many older women have diabetes. Without knowing it, smoking, even in the past, can contribute. It damages the heart and blood vessels over time. Even secondhand smoke can raise the risk. Obesity and a sedentary lifestyle also contribute to the issue. Carrying extra weight puts stress on the heart. Lack of exercise weakens the cardiovascular system. Stress and poor diet don't help either. Eating processed foods high in salt and sugar can harm heart health. Chronic stress also raises blood pressure. Now, let's address some common misconceptions. Many older women think heart attacks always involve severe chest pain. That's not true. They might also believe heart disease is a man's problem. But women are just as likely to develop it. Women often fare worse after a heart attack. Another myth is that you're safe if you feel fine most of the time. Silent heart attacks can happen without you realizing it. That's why regular checkups are so important. Let's explore how women often miss the signs of a heart attack. Often, it's because they're busy caring for others. They might dismiss symptoms as just aging or nothing serious. Cultural factors can also play a role. Some women feel they shouldn't complain about health issues. They push through discomfort, hoping it'll pass. Doctors sometimes miss the signs. Women's symptoms can be less obvious than men's. This can lead to misdiagnosis or delayed treatment. So, how can older women protect themselves? First, know the warning signs of a female heart attack after 70, fatigue, shortness of breath, and nausea are key red flags. Pay attention to your body. If something feels off, don't ignore it. Trust your instincts and consult a medical professional for guidance. Regular checkups are crucial. Get your blood pressure, cholesterol, and blood sugar checked. These tests can catch problems early. Lifestyle changes can make a big difference. Eat a heart-healthy diet, rich in fruits, vegetables, and whole grains. Limit your intake of salt, sugar, and processed foods. Exercise doesn't have to be intense. A daily walk, like Clara's, can keep your heart strong. Even light stretching or yoga helps manage stress through relaxation techniques. Meditation, deep breathing, or spending time with loved ones can lower stress levels. If you smoke, quitting is one of the best things you can do. It's never too late to stop. Your heart will thank you. Weight management is also key. Even losing a small amount of weight can reduce heart strain. Discuss a safe plan with your doctor. Medications might be necessary. If you have high blood pressure or cholesterol, take your meds as prescribed. Don't skip doses. Let's talk about family history. If heart disease runs in your family, your risk is higher. Share this with your doctor for tailored advice. Technology can help too. Wearable devices can track heart rate and activity levels. They can alert you to unusual changes. However, no device can replace a doctor's expertise. If you experience unusual fatigue or discomfort, contact your doctor immediately. Don't wait. Let's revisit Margaret's story. After her diagnosis, she made changes. She started eating more vegetables and reduced her intake of salty snacks. She also joined a senior walking group. The social aspect kept her motivated. Plus, it helped her manage stress. Her doctor prescribed medication to control her blood pressure. Regular checkups ensured her heart was monitored closely. Clara's story has a happy ending. But not every woman is so lucky. Silent heart attacks in women can lead to serious complications. Heart failure is one risk. A weakened heart struggles to pump blood effectively. This can lead to fatigue, swelling, and breathing problems. Arrhythmias, or irregular heartbeats, are another concern. They can increase the risk of stroke or sudden cardiac arrest. The good news, many of these risks can be managed. Early detection and lifestyle modifications can significantly improve outcomes. Let's talk prevention in more detail. A heart-healthy diet is a great start. Focus on foods like salmon, nuts, and leafy greens. Limit red meat and fried foods. Choose olive oil over butter. Small changes add up over time. Exercise is non-negotiable. Aim for at least 30 minutes most days. Walking, swimming, or even gardening counts. Sleep matters, too. Poor sleep can raise blood pressure and stress hormones. Aim for 7 to 8 hours of quality sleep each night. Mental health is just as important. Depression and anxiety can harm heart health. Seek support if you're struggling. Social connections are vital for older women. Loneliness can increase heart disease risk. Stay connected with friends and family. Regular screenings can catch issues early. Ask your doctor about EKGs or stress tests. These can detect silent heart damage. If you're on medications, understand their purpose. Statins, beta blockers, or blood thinners can help protect your heart. Follow your doctor's guidance. Let's address a common question. Can stress cause a heart attack? While stress alone may not cause one, it can contribute. Chronic stress raises cortisol and blood pressure. Learning to manage stress is crucial. Try mindfulness or hobbies you love. Even a short walk can calm your mind. Another question. Are silent heart attacks less dangerous? No. They cause the same heart damage as a classic heart attack. The difference is in the symptoms. This is why education is so powerful. Knowing the early signs of a heart attack in older women can save lives. Share this knowledge with loved ones. Let's talk about when to seek help. If you feel unusual fatigue, shortness of breath, or nausea, don't wait. Call your doctor or 911. Time is critical during a heart attack. The sooner you get treatment, the better your chances of recovery. Don't hesitate. Hospitals use tests such as EKGs and blood work to diagnose heart attacks. Treatments like angioplasty can quickly restore blood flow. Medications can also help. Aspirin, for example, can thin the blood and reduce damage, but only take it if a doctor advises. Recovery after a heart attack takes time. Cardiac rehabilitation programs can help. They teach exercise, diet, and stress management. Support groups are another resource. Connecting with others who've had heart attacks can be empowering. You're not alone. Let's wrap up with hope. Heart disease is severe, but it's not a death sentence. With awareness and action, women can live long, healthy lives. Clara is proof. She's back to her walks, playing with her grandkids, and enjoying life once again. Her heart is stronger because she acted in time. You have the power to protect yourself or a loved one. Listen to your body. Don't ignore the early signs of a heart attack in older women. If this video resonated with you, hit that like button. It helps spread this critical message to a broader audience. Share this video with the women in your life, especially those over 70 years old. They need to know these female heart attack warning signs. Subscribe to our channel for more life-saving health tips. We're here to keep you informed and empowered. Drop a comment below. Have you or a loved one experienced these symptoms? What's your story? Let's start a conversation. Together, we can raise awareness about the symptoms of heart disease in older women. Let's make sure no one misses the signs of a silent heart attack. Thank you for watching. Stay heart healthy and take care of yourself and those you love. We'll see you in the next video.